Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another classification number 19, that is a coagulants anticoagulant drugs, that is a drugs acting on a blood. This classification is very important for your GPAT Niper Drug Inspector and Government Pharmacist exam. So I would like to request you, please watch this video until end. My dear students, we have already seen 18 videos on the classification part. If anybody has not seen previous videos, please go in the channel's playlist and watch all the previous videos, because these classification videos, they are very important for your GPAT Niper DI Pharmacist exams. Lot of questions are going to be covered from those videos, so please watch all the previous videos. My dear students, I will try to cover at least 5 to 10 questions from today's session. Before starting the actual classification, you should know few terms. So first term is nothing but the coagulants. What do you mean by coagulants? Coagulants किसे कहते हैं? So coagulants means any drug or any agent that can increase the blood coagulation process or blood clotting process, right? That is known as a coagulants. So those drug which increases the clotting, which enhances the blood coagulation process, or which increases the homeostasis, known as the coagulants. Examples: vitamin K is there, then adrenaline is there, gelatin foam is there. All other vasoconstrictor, they will increase the blood coagulation. Then all blood clotting factors, they are also coagulants. So these are the coagulants. Now another term you should know, next term is anticoagulants. What do you mean by anticoagulants? So these are the drugs which will decrease or which will prevent the blood coagulation process. They will prevent the coagulation of blood. They will prevent the homeostasis, known as anticoagulants. Now another term is there, known as thrombolytics. So what do you mean by thrombolytics? If there is any clot in your blood vessel, known as a thrombus, or known as a thrombus or clot, these drugs, thrombolytics, they will break this clot, they will break this thrombus. So those drugs which used to break down the thrombus or already formed a clot in the blood vessel, that is known as a thrombolytic. Now these three terms are very important, and also you should know the physiology of blood coagulation, different blood coagulation factors and all that. So that is beyond the scope of today's video, so I will not take that. Directly move to the today's important part, that is a classification of anticoagulants. So anticoagulants, they are classified into different types: parenteral anticoagulants, second oral anticoagulants, and third is nothing but the antiplatelet agents. So in the coagulation process, the primary part of coagulation process is nothing but the aggregation of your platelets and formation of platelet plug. That is the main primary task while blood coagulation. Platelet will be attracted to injured part, and there will be platelet plug formation will be there, and after that, that is a clotting. So anticoagulants, they are of different types: natural anticoagulants, semi-synthetic one, oral anticoagulants, antiplatelet drugs. So we are going to see it one by one. So first, anticoagulants. So anticoagulants, they are classified into two parts. First one is nothing but the parenteral anticoagulants. So those drugs which are given by injection route, known as the parenteral, and oral anticoagulants, those drugs which are used orally as an anticoagulant. Okay, so first we will see parenteral anticoagulants. So in that you have direct thrombin inhibitors and indirect thrombin inhibitors. So first we will see indirect thrombin inhibitor. So thrombin is nothing but the blood clotting factors. So what are the examples of indirect thrombin inhibitors? जो indirect thrombin को inhibit करने वाले हैं, वो है natural anticoagulants. For example, heparin. Heparin is a natural anticoagulant found in your liver, also found in your GIT, also found in your lungs. So heparin is the most acidic compound, natural anticoagulant found in your body, right? So heparin. Then its molecular weight is around 10 to 20,000 Dalton. Now this is a native heparin or normal heparin. Now low molecular weight heparin. Low molecular weight heparins, they are produced by fractionation of normal heparin. So low molecular weight heparin will have molecular weight in the range of 4 to 7,000 Dalton, right? So in that you have enoxaparin, reviparin, natroparin, dalteparin, pernaparin and adrenaparin. So these are the low molecular weight heparins. They have certain advantages over heparin. Okay, so that is also beyond the scope of this session. The next one is a fondaparinux and donaparoid. So fondaparinux and donaparoid, they are nothing but the heparan sulfate or heparin like compounds. Now they are known as the indirect thrombin inhibitors. Now next part is nothing but the direct thrombin inhibitors. So in the direct thrombin inhibitors, these direct thrombin inhibitors. So lepirudin, bilavirudin and argatopran. Lepirudin, bivalirudin and argatopran. These are known as a direct thrombin inhibitor. Now direct thrombin as well as indirect thrombin inhibitor, they are used parenterally. They are not used orally. So that's why they are known as a parenteral anticoagulants, right? Now we'll see the oral anticoagulants. Now next is the oral anticoagulants. So these drugs are given by oral route and they are known as the oral anticoagulants. So in that you have three subclasses. Now first one is nothing but the coumarin derivative. So they will have coumarin ring in their structure. So that's why coumarin derivative. They are first time isolated sweet clover grass. So spoiled sweet clover grass in the America. So by eating this grass, lot of cattle were suffering from hemorrhagic diseases. तो जानवरों ने क्या किया कि स्वीट क्लोवर लीफ नाम का जो ग्रास है वो खा लिया और उसकी वजह से उनका ब्लीडिंग हो गया, ब्लड क्लॉटिंग नहीं हो रहा था. सो आफ्टर दैट it was found that it consists of a dicoumarol, that is a bis-hydroxycoumarin. Now coumarin derivative, in that you have bis-hydroxycoumarin or dicoumarol, bis-hydroxycoumarin or dicoumarol, then warfarin, then acinocoumarol, then ethyl biscoumarin acetate, right? So these are the coumarin derivative known as an oral anticoagulant. Now second class in the oral, that is a direct factor 10 inhibitor. So you should know what do you mean by factor 10. So factor 10 is known as Stewart power factor. So direct Stewart power factor inhibitor, rivaroxaban. Rivaroxaban is a direct factor 10 inhibitor, right? Now third class in the oral anticoagulant, oral direct thrombin inhibitor. So in that dabigatran etixylate. Whatever anticoagulant drugs we have seen, parenteral as well as non-parenteral, so they are known as in vivo anticoagulant. इनको क्या बोलेंगे अपन? In vivo. So all these are the in vivo anticoagulants. So they inhibit the blood coagulation process inside the body. They are known as in vivo anticoagulants. Now those drugs which will inhibit the blood coagulation in the test tube, that is an in vitro anticoagulant. So they are mostly added in the test tube to prevent the blood coagulation in vitro before the blood examination, right? So in that you have heparin, sodium ethylate, sodium citrate, sodium oxalate. So they are known as in vitro anticoagulants. ये blood को test tube में coagulate नहीं होने देंगे. So they are known as in vitro anticoagulants, and these are known as in vivo anticoagulants. We will see the next again classification. Now next one is fibrinolytics. So what do you mean by fibrinolytics, or it is also known as thrombolytics? Fibrinolytics or thrombolytics. So what will they do? They will break down the already formed blood clot. So fibrinolytics or thrombolytics, they will break down the already formed clot in the blood. अगर blood vessel में कोई already clot है तो उसको break करने वाले drug कौन है? Fibrinolytics or thrombolytics. So all these are the tissue plasminogen activator. ये क्या है? Tissue plasminogen activator. ये सब क्या है? Tissue plasminogen activator. So in that you have streptokinase, which is obtained from hemolytic hemolytic streptococcus bacteria, that is streptokinase. Now urokinase, it was also isolated from urine. Then alteplase is a recombinant DNA technology made plasminogen activator. Then retiplase is there. Then tenecteplase is there. Tenecteplase is nothing but the modified streptokinase only. So remember, streptokinase, urokinase, alteplase, retiplase, tenecteplase, they are known as a tissue plasminogen activators, and they are used as a thrombolytic. They will break down the already formed a clot in your blood. Now next one is anti-thrombolytics or anti-fibrinolytics. This, that means these are the drugs which are against the thrombolytics. They will increase the blood clotting. They will increase the thrombus formation. They will stop your blood. They work like a coagulants. Example is nothing but the epsilon amino capric acid, tranexamic acid. Tranexamic acid is used in the treatment of excessive bleeding in the women's during the menstrual cycle. This epsilon amino capric acid is also used for the same condition. Ethamycilate is also used for the same condition. So fibrinolytics means those drugs which will break down the already formed a clot. Antifibrinolytic means they will increase the blood clotting. Right? Now next we'll see anti-platelet agents. इसके ऊपर बहुत बार क्वेश्चन आ चुके हैं. So you have to be clear regarding this topic. They have already asked question on this. So anti-platelet drugs or anti-platelet agents, they are also known as anti-thrombotic drugs, anti-platelet agents or anti-thrombotic drugs. Now first one is in that thromboxane A2 synthesis inhibitor. In that you have aspirin. So aspirin is a thromboxane synthesis inhibitor. Aspirin will inhibit the cyclooxygenase enzyme FOX1 and will prevent the synthesis of thromboxane. Thromboxane क्या है? Thromboxane is a pro-platelet aggregatory chemical. तो ये thromboxane A2 क्या करेगा? प्लेटलेट को एग्रीगेट करेगा. अगर प्लेटलेट एग्रीगेशन हो गया है तो क्लॉटिंग हो जाएगा. ठीक है. So that's why aspirin is anti-platelet agent. It is used in the dose of 75 to 150 milligram for the prophylaxis of microemboli, for the prophylaxis of myocardial infarction, for the prophylaxis of deep vein thrombosis. Right. Now again, next class in the antiplatelet is a platelet cyclic AMP enhancer. So example is a dipyridamole. You have to remember question already आ चुके. So platelet cyclic AMP enhancer means this dipyridamole will increase the cyclic AMP in the platelet. Dipyridamole is also known as a phosphodiesterase inhibitor. इसको क्या बोलते हैं? Phosphodiesterase inhibitor. And inhibition of phosphodiesterase will increase the cyclic AMP level in the platelets. Phosphodiesterase inhibitor, dipyridamole. You have to remember. Now third class in the antiplatelet is nothing but the P2Y12, that is a prologenic receptor blocker or ADP receptor blocker. They are also known as ADP receptor blocker. ADP receptor blocker. So example is ticlopidine, clopidogrel and prasugrel. So these three are grels and pidine. Ticlopidine, clopidogrel, prasugrel, they are known as a ADP receptor inhibitor. ADP receptor inhibitor or P2Y12 receptor inhibitor. ये receptor होता है platelet के ऊपर and that receptor is involved in the platelet aggregation. Fourth class of antiplatelet drug, that is a glycoprotein 2B3A receptor antagonist. Glycoprotein 2B3A receptor antagonist. In that you have abciximab, iptapivatide and tipropiban. These three drugs, they are known as a glycoprotein receptor antagonist. They will prevent the attachment of platelet to the exposed collagen of your blood vessel. अगर आपके ब्लड वेसल में कोई कट आता है तो वहाँ पे आपका कोलेजन रिलीज होता है. कोलेजन इज नथिंग बट द कोलेजन इज अ प्रोटीन व्हिच अट्रैक्ट्स योर प्लेटलेट्स टू फॉर्म प्लेटलेट प्लग. So that platelet attaches to the glycoprotein, or platelet attaches to the glycogen via platelet receptor, and that receptor is nothing but the glycoprotein 2B3A receptor. So its antagonists are used as an antiplatelet drug. Abciximab, iptapivatide and tipropiban. So that is an antiplatelet drug. We'll see it again. So drugs used in the disorders of coagulation. Procoagulant means they are known as coagulants. Procoagulants or coagulants like adrenaline, thrombin, fibrin, gelatin foam, astringent, and vitamin K. So all the blood clotting factors, they are procoagulant or clotting agents, right? So adrenaline is a vasopressor; it increases the blood coagulation. Okay. Gelatin foam also increases the blood coagulation externally, known as a styptic drug. Astringents and vitamin K, right? Now anticoagulants. So anticoagulants example. In that you have heparin. Heparin is a natural anticoagulant acidic compound. It is a mucopolysaccharide. Okay, molecular weight 10 to 20,000 delta. Its antagonist is a protamine sulfate. You have to remember this. Heparin is a in vivo as well as in vitro anticoagulant. Heparin क्या है? In vivo as well as in vitro anticoagulant. Then low molecular heparin, low molecular weight heparin, उसका molecular weight कम होता है and they are made by fractionation of heparin. So low molecular weight heparin का weight होता है molecular weight 4 to 7,000 delta. Heparin का होता है 10 to 20,000 delta. So in that you have enoxaparin, deltaparin. Okay, then oral anticoagulants, in that you have warfarin, nucleomalone, then phenindione, and nicomalone, phenindione, and warfarin, nicomalone, and phenindione. Now third category is nothing but the antiplatelet agents. So antiplatelet drug, they will prevent the platelet aggregation, right? So antiplatelet drug, in that you have aspirin. It irreversibly inhibit the aspirin will irreversibly inhibit the cyclooxygenase 1 and prevent the synthesis of thromboxane. Thromboxane is a pro-platelet aggregatory chemicals. Then dipyridamole, it is a phosphodiesterase inhibitor. Ticlopidine, clopidogrel, all these are nothing but the ADP receptor antagonist. Abciximab, then iptacopan, they are known as a glycoprotein 2b3 receptor antagonist, and this epoprostenol. Epoprostenol is a prostaglandin analog, prostaglandin E2 analog. Next one is a fibrinolytics. They are known as a thrombolytics, right? Thrombolytics. In that you have tissue plasminogen activators like streptokinase, obtained from Streptococcus bacilli, hemolytic Streptococcus bacilli. Urokinase, obtained from urine. Altaplase, recombinant DNA technology made tissue plasminogen activator. And anistraplase and retiplase. All these tissue plasminogen activator, they are thrombolytic. They are used in the myocardial infarction to break the thrombus, right? Now antifibrinolytics. So in that you have epsilon aminocapric acid, hexanamic acid, and aproteinin. Right? These are the antifibrinolytics. Right? We'll see the classification again. So anticoagulants are classified mainly in a two type. First one is oral anticoagulants, and second one is a parenteral anticoagulants. Parenteral anticoagulants. In the parenteral anticoagulants, you have direct thrombin inhibitors and indirect thrombin inhibitors. So direct thrombin inhibitors and indirect thrombin inhibitors, right? Indirect thrombin inhibitors, in that you have unfractionated heparin, then fractionated heparin, that is a low molecular weight heparin, and heparin like compounds like fondaparinux and idraparinux. They are the heparin like compound or heparinoids. Okay, so this normal heparin, low molecular weight heparin, and heparinoids. Okay. Now in the direct thrombin inhibitor, you are having uridine, that is it is obtained from natural sources, then lepirudine, then bilavirudine, ergotaban, and melagatran. These are the direct thrombin inhibitor. And in the oral, you have vitamin K inhibitors or antagonist of vitamin K. That is a warfarin, dicomarol, acinocomarin, phenindione. So they are the vitamin K antagonist, right? Now in that second oral anticoagulant, factor 10 inhibitors, that is a steward power factor inhibitor like rivaroxaban and apixaban. And in that third category is the direct thrombin inhibitors. So these are the direct thrombin inhibitors. So in that you have dabigatran, itaxylate, and zimegatran and dabigatran. These are the anticoagulants. Now we will see the antiplatelet agents again. Antiplatelets, they will prevent the platelet aggregation, right? These drugs will prevent the platelet aggregation. Now in that you have COX inhibitors. COX inhibitor means aspirin. It will prevent the synthesis of thromboxane A2, right? Then phosphodiesterase inhibitor, or it will increase the cyclic AMP level in the platelet. So dipyridamole. Then third one is a ADP receptor antagonist or ADP receptor antagonist or P2Y12 receptor antagonist. In that you have two, reversible one and irreversible one. So reversible one is nothing but the Cangrelor and Ticagrelor. Cangrelor and Ticagrelor. Irreversible inhibitors of ADP receptor. They are nothing but the ticlopidine, clopidogrel and prasugrel. Right. Now next one is nothing but the glycoprotein 2B3A receptor antagonist. In that you have AB6 tipropivan and iptipipatide. Now this last one is a PAR antagonist, platelet activating or platelet receptor antagonist. So Barapaxar and Atopaxar. So these are the drugs. So antiplatelet drugs, thrombolytics, antithrombolytics, and anticoagulants. Very very important. I have tried to cover at least 10 to 15 questions from this. You can order this magic bullet for GPAT Niper DI Pharmacist exam. Read twice and qualify 100%. It's our guarantee. You can see we have very much promising results from past few years. Thousands of students they are placed in the Niper just by reading these books and doing self-study. You can also join our GPAT Niper 2024-25 online course. In that you have live lectures, recorded lectures, study material, test series, everything in a 8,000 rupees. And if you get all in the rank 20 or below 20, this will be written in the form of reward. Thank you.
Hello students, order the magic bullet for GPAT Niper Drug Inspector, read twice and qualify 100